absolutely state clinic, and we are regional children's hospital for Dnipro region. And we are a regional NICU, both for Dnipro region and particularly for nearest regions of Ukraine.
Now we have a completely new building with modern techniques, building techniques, of course, and medical techniques.
Overall goal is to make all clinics like new, like modern. And overall goal, we have a very big region, about 330 kilometers from the east to west.
We have a lot of small patients, a lot of children with club feet, because it's the second most common orthopedic congenital disease. And we started to treatment according to modern, world accepted protocol, according to Ponseti method.
When I arrived here in Ukraine in 2010, I was told you never want to end up in a public hospital. Well, now I'm in Dnipro at a hospital that's trying to change all of that. It's become one of the most innovative in the country, and it serves mothers and children. Let's have a look. So how long have you been a doctor with this hospital?
More than 25 years.
Wow, and so you've seen it change from a more kind of a Soviet system to what it is today.
Yes, really. And it's tremendous changes we have seen, and it was an old building which was made more than 100 years ago on a charity money of citizens. And now we have a completely new building with modern techniques, building techniques, of course, and medical techniques.
And it's not just it's not just the medical techniques as well. It's the whole system that's changed with it.
Yes, right. In this hospital, we opened a new program and built early intervention department, so-called fragile baby program. And we combined here outpatient department, pediatric and rehabilitation department. Our hospital mostly devoted for neonates, preterm neonates, surgical neonates. Of course, it's very important for them have some follow-up and further treatment.
And it's kind of a new thing somewhat for Ukraine. I mean, this idea of this comprehensive care. I think a lot of issues happen when babies go home, neonates that have problems, and they don't have that follow-up. So this hospital is providing that.
Yes, we do it, and it's not so easy for our patients to get to the hospital, and especially for our patients, because they have a long way for recovery, and they a really fragile baby.
And they need to have that whole system there, not exactly one doctor, but the entire system looking at
multi-center care.
And now I know you were involved with something with neonatal care some years ago, with changing how neonates are cared for here.
We performed neonatal surgery in a long time, maybe more than 30 years, but we have a tremendous start after my visit to United States, Children's Boston Clinic.
And before that, what was the mortality rate for children?
It was very high, nearly 90%.
Wow, so 90% of babies, 90%. Neonates that needed
surgical neonate died because of poor reanimation or intensive care, because the old procedures and surgical techniques And after that, when I studied during 7 weeks in Dr. Hendren's office, I bring a lot of software, so-called, and we realize it here.
What are some of these innovations that you've seen here? Something maybe that you haven't seen or been able to use before in Ukraine?
It's very great that we can, an opportunity right now to use 3D scan, that we can, with help of it, we can treat our patients with scoliosis or some other types of deformities, spine deformities. For example, I showed you a case, this small girl, she is 3.5 years old with tuberculous spondylitis. It's a dangerous thing, it's a very severe, very progressive kyphotic deformity because of the destruction of one of her vertebrae.
And I have one more question. You've been a doctor for 10 years. You're really in, you have this specialty, this special knowledge, and you're really pushing forward. And not only that, you speak excellent English. So let me tell you this. What keeps you here? So many people in your position would find this as a great opportunity to leave Ukraine and to go to Germany or the US. So what keeps you here in Ukraine?
I understand your questions. First of all, I love my country and I want to change the things inside here, not trying to relocate. I'm trying to change and to push forward here. I think that is the only one way how we can change all of the things in our country.
Generally, we're expecting a lot of changes in the admissions of our departments. For example, nowadays the patient's supposed to come to our department and then we call for the specialists to come to see them, to do the primary investigation, and if they need some kind of specific tests, they need to travel around the hospital, to the laboratory, to the ultrasound, to the X-ray in a different parts of the hospital. With the new building opening, everything will be focused on the first floor. So they entering, the specialists are already there, they're ready for admission. They will check the patients, and if there is necessary to do some kind of examination like an X-ray or ultrasound or a CT scan, they can easily travel next door, to the next door. And we plan to open an urgent cases as well, so the hospital will be able to receive the patient with the sharp traumas. So that's happened recently. And I think that will be really, really good as for the city, as for the hospital, and for the patients as well.
And now, so that helps to decrease mortality to, what's the mortality rate now? It was 10 years ago. And
I'm proud to see that we have surgical post-operative mortality nearly 0.5%. It's quite good.
It's an amazing change in 10 years. And now this hospital and these changes are kind of the next step in the evolution of neonatal care here in Ukraine.
Yes, and in this new surgical building, we will have cardiac surgery, head and neck surgery, orthopedic surgery, and general pediatric surgery and neonatal surgery.
And that's the building we see here. This
Yes.
is the one that's not finished yet.
Few months.
And so then you'll be able to increase the patient capacity by how much? What percentage?
Maybe twice.
So 2 times as many patients to be able to care, and the outpatient in this continuous stage.
Yes.
And what are you seeing with this change already? What do you see with your doctors, your new and old doctors, your nurses, your patients? What did you notice immediately? Or
Of course, my staff inspired of this event, and they're really proud to work in this building. It's a pleasure for patients and for staff.
I'm here at the Rydnovo Maternity and Children's Medical Center in the very heart of Dnipro. And this is where renovations have been going on to change the medical system. And I have an opportunity to see for myself. going to go meet the man who had a vision for a technologically advanced neonatal intensive care unit, like the one he saw in Germany, and he believed it could be built here in Dnipro, Ukraine. Dr. Denis Sirkov. Let's go.
This is absolutely state clinic, and we are regional children's hospital for Dnipro region, and we are regional NICU, both for Dnipro region and particularly for nearest regions of Ukraine, because we have a specialized neurosurgery center for pediatrics and for newborns, and here in this center we perform a lot of neurosurgery operations regarding, for example, IVH and hydrocephalus or congenital diseases and so on. And some regions near Dnipro, they don't have a specialized neonatal neurosurgery, so we treat babies from different regions here.
I know that part of this has come about because of decentralization.
Yeah.
You know, and the ability
Sure, yes,
to use.
absolutely.
And so what led to the renovation?
You know, when we have found this department, it was based 9 years ago here in this hospital. The aim was not just to get standard care for newborns. The main aim was to use high tech.
For this neonatal
Yes,
care.
for neonatal. So, and we are Center for High Technology, intensive and surgery care for newborns, not just for Dnipro region, but we have some possibilities. Just one center in Ukraine, for example, ECMO. So we start this year ECMO program.
And this is the heart-lung bypass system, right, with the ECMO. So this is when a child or a newborn has some type of problem where
Usually we have some typical indications for ECMO in neonatal period, including meconium aspiration syndrome, congenital diaphragmatic hernia, and severe respiratory distress syndrome with pulmonary hypertension of neonates.
So the region started this renovation of hospitals, and I believe at hospitals, clinics, and now we're standing in one of the newest completed projects. So what is the overall goal here when it comes to renovation?
Overall goal is to make all clinics like new, like modern. And overall goal, we have a very big region, about 330 kilometers from the east to west. And it's mean 2 years ago, 1 year ago, 5 years ago, if you live in village, in little village, maybe in somewhere in Mizhivaya, it's about 150 kilometers. And if you want to receive a medical help, you need to go here to Dnipro.
Which makes it really difficult for emergencies, for things that are significant, for follow-up care. People are less likely, I imagine, when they have a chronic illness.
Yeah, and due to this big distance, people even can die if this help will not give him emergency. That's why we started from the big hospitals in Dnipro, because we like regional administration and we are owners of these hospitals and we can repair it. Now we started a big program to build new little clinics in every village. It means every village will have its own little clinic. We have many universities, medical, in our country. And if students after university want to go to this village, we will give him at home and good condition for the work.
Oh, so great. So this helps residents to get experience, and it serves the local community.
Yeah.
And today we're here at the first project. And you were saying that, of course, you started in the big city, but you started with a children's clinic.
I think 80% of all that done by us done for the children. Because when we will very old, these children will manage this country, and we want to live in a good country in our old years. Another our options that any children, when they came to any hospital, they always cry.
It's painful, it's associated with negative things.
Yeah, but we want to give them here a friendly environment, like in kindergarten, like in a good European school.
And I've been to some hospitals here in Ukraine, and often it's a drab, green, kind of mint color, these concrete walls. They just don't feel inviting for anyone, and I can imagine how children would feel. Yet here I notice in this clinic, it's completely different when it comes to the colors.
Yeah, and it's like a system of broken windows. When doctors who works, for example, in this clinic, first came here and see this environment, all of them say, oh, okay, it's like in Europe, it's like in the United States, and they started to smile. Because in recent clinics that were built in Soviet Union times, it's a very rare situation when you see a doctor and doctor smile.
When you're working in somewhere that's just drab and gray and miserable, of course you reflect that. But I know here, this is not of course, making the walls beautiful and the colors bright and inviting, this is absolutely probably the change we see, but this is not the major change, I imagine.
Yeah, because main change is that all doctors receive opportunity to work in modern conditions. And now we understand that near this building, we finish in 1 month another 7 stairs building of this clinic. It's almost new. Because this was reconstruction, that building is new from the ground and to the up. And now we understand that some students and some good doctors from nearest regions, for example, from Zaporozhye region, Kharkivskaya region, will come here and they want to work here because we give them best conditions. And when we made best conditions, we receive best doctors. We want to have best doctors all over the Ukraine here in Dnipro.
So that was the neonatal intensive care unit here at the Dnipropetrovsk Regional Maternity and Pediatric Hospital. So many people would ask, how could that possibly happen here in Ukraine? Well, decentralization is only part of the answer. It takes people with vision, knowledge, and the commitment to see it through. And that's not happening just here in Dnipro. That can, should, and will happen everywhere in Ukraine.